Former President Joe Biden's message on his recent prostate cancer diagnosis on social media says, "Cancer touches us all. Like so many of you, Jill and I have learned that we are strongest in the broken places." The former president has been diagnosed with an aggressive form of prostate cancer. According to the president's office, the cancer has metastasized to the bone. Our 9 News medical expert joins us now, and we know we've been talking about this for a while today and actually for the last 3 days. When you hear that, it sounds terrible. What's the general prognosis? He is older. Sometimes cancer moves slower in older people.
Yeah, I mean, and honestly, our wishes go out to him and his family. But the good news here is that prostate cancer is really one of those indolent or slow-growing cancers. So even if people have metastatic or stage 4 prostate cancer, they can have a good quality of life. They can have high level of functioning depending on the treatments that they're getting. Now, if prostate cancer is caught early, it has essentially a cure rate. You can take it out and cure the person. And the survival rate at 5 years is 97% overall. But for metastatic prostate cancer that's already spread outside the prostate, it's about 30 to 40% at 5 years. But again, it can be a very good quality of life during that time, depending on which treatments he chooses.
But now that it's spread to the bones, I mean, what options does he have? Like, chemo doesn't work in that case, does it?
Well, so surgery is off the table, because usually we would do surgery, which is a radical prostatectomy, taking out the prostate if it's localized. Chemotherapy can be an option, but the tricky thing is that President Biden is 82 years old, and chemotherapy can be tough. At that age, it can cause problems with mood and other types of problems with kidney function, as well as bone marrow suppression and such. So I would say his 2 main treatment options are, number one, the good news is that the cancer is hormone sensitive. So I think his physicians are probably going to reach for hormone blockers, something called androgen deprivation therapy. You give antagonists or blockers of testosterone, so that kind of chokes off the cancer's growth supply. Radiation is also a really good option, both for the fact that he has metastatic disease in his bones. They can radiate it, but they could potentially also radiate the prostate cancer itself in the prostate, and that'll prevent it from spreading. The good news with President Biden, he didn't have any pain from the bone disease, and that's actually a sign that the cancer may be more responsive. It's a good prognostic sign. It also means that he's more likely to respond to the radiation, maybe not need as much for symptom control or pain.
Well, I remember when he was vice president, he came out here and spoke at CU about the moonshot for cancer. Yeah. And, cancer's touched his family with his son, Beau. It's 1 in 3 when you think about it. Was there something that he missed? I know that's been talked about with this PSA test, everything. Were there symptoms that anybody should be saying, hey, this is happening?
You know, a third of prostate cancers, Kim, have no symptoms, sometimes even up to half of them. So that PSA testing is really important, especially in that younger population, especially African Americans or those with family history. So I would say his family now definitely needs to start screening early at the age of 40, not even wait till 45 or 50. But if you do have symptoms, and men can have symptoms sometimes, urinary symptoms, which is what President Biden had that prompted all this, it's really important to get it checked out. So you can have, blood in your urine or in your semen. You can have frequent needs to go to the bathroom or feeling like you're not emptying completely. When you go to the bathroom, you can have some incontinence or dribbling. These are all early symptoms, but then when it progresses, you could even have symptoms of bone pain, back pain, weight loss, fatigue, the signs of advanced cancer as well.
Yeah. Any outstanding questions you still have surrounding this?
I have a lot, actually, really? Alex. I'm just trying to sort of see where they're going to take his treatments and what his doctors are going to do. But the first is, how soon are they going to start treatment? Because we heard it's an aggressive cancer, which means it spreads very effectively. And these are a subset of prostate cancers. And it needs usually a combination of treatments in order to treat it effectively. That's why I think they'll need more than one thing. The second is about his bones. How many bony mets does he have? Is it just one spot in his bones, or does he have a lot? Because that's also going to determine the prognosis as well as some of the treatments. It gets more likely to use systemic treatments like chemotherapy if you've got spots everywhere, whereas radiation works better if you have just kind of focal spots everywhere. And then the third, which sounds very grave, is that have they checked his brain and other parts of his body? Because the cancer, prostate cancer, can spread to your brain as well. So it's really important for him to get a full staging workup to know exactly the extent of the disease.
Well, let's hope, like with all these cases, you don't wish that onto anyone, and you just hope that we all educate ourselves.
But I really think for the young people, the older men, I mean, men also ignore their health a lot.
Yes,
screen, because it can be asymptomatic, and in your 40s, you start talking about screening, and we've talked about this on the 3 o'clock, but maybe we should keep screening later in life as well, because people are living a lot longer now.
Change those guidelines.
Yeah.
Dr. Kohli, thank you. As always, you can find more with Dr. Kohli at Dr. Kohli at 9news/Dr. Kohli.